Good morning, good afternoon, good evening, depending on when you will be watching this video. My name is Charlene Clark. I'm one of the project leads for the Archipel Ontario Health Teams, which is one of the OHTs that has been helping the Winning Strategies team do the implementation across our Ontario East region. Today we will be going through the champions training to give you an overview and an explanation on what the winning strategies are, um, best practices, potential challenges that you may face, and overall look through uh, for these guidelines, which we also call um, strategies. In French, it's les stratégies gagnantes. This training is also offered in French, but if you are watching this video, you most likely selected the English version. Because this is not interactive, unfortunately, um, have the you won't have the ability to ask any questions. But you can definitely send your questions to um, the Winning Strategies team, and we will be working with you to answer any of your questions and address any concerns that you may have regarding implementation. So we can get started. Just making sure that this works. There you go. All right, Winning Strategies, the training for champions. My computer is a bit slow, so I might take a bit longer. Um, There we go. So the training objective to empower and support champions uh, in planning and implementing winning strategies for serving Francophones within their organizations. So the outline will go through why you should adopt the winning strategies, what's the difference between active offer and the winning strategies, what are the 6 winning strategies, and how to plan and implement the winning strategies within your organization. So first, we'll look into the why. There are many reasons, but the 2 main ones are because Francophones in linguistic minority situations are not all bilingual when it comes to expressing their emotions and symptoms. And 2, they do not always request their healthcare services in French out of fear that their preference will negatively impact the quality of the care, accessibility to treatments, treatment times, and other inconveniences. We've had many experiences as Francophones where we might select the English line over the French line because when we do select the French line, the wait times are extremely high. And as exactly as it's said, we out of convenience, we choose the English route, even if it might not be our preference. And we also have a saying for the first point, which is that when we're sick, we're not bilingual when we're sick. And so there are many situations where Francophones might come into their place of care. Um, and being placed in a situation where they have to express their symptoms and emotions in a language that they're not comfortable in can create some tensions and confusions and ultimately impact the quality of the care that they receive. So positive impacts of French language health services for Francophones, the ability to express the needs and explain symptoms, better understanding of and compliance with the treatment plan, improved experience for Francophone clients, and improved self-management. So just overall better understanding of what's happening to them, the ability to express what's going on, and after when the patient or client is discharged or encouraged to go back home and into the community, being able to manage their treatment plan or their care plan themselves is a lot easier for them. The positive impacts for French language health services for healthcare professionals, more accurate assessment of health status, better interpersonal interaction during treatment, good communication with Francophones or with Francophone clients, and improved staff experience. The positive impacts for healthcare providers, improved quality and safety of care, person-centered approach, the reduced risk of delivery problems and better risk management, and of course, reduced costs. So what is the difference between active offer and the winning strategies? So in concrete terms, active offer takes the form of a range of health services available in French and offered proactively, which means that services are clearly advertised, visible, and easily accessible at all times without placing the responsibility of requesting services on the clients. Um, so when we look at the differences between the two, the active offers applies to designated agencies and third parties providing Ontario-funded public services. It ensures availability of the actively offered French language services from the first point of contact. And there are 9 prescribed measures that ensure French language services are offered at all times, clearly communicated, immediately visible, and easily accessible, and of a quality equivalent to that of services offered in English. So this is definitely in line with the rules, regulations, and laws regarding French language services, whereas the winning strategies, it applies to all organizations in the health, social services, and community sectors, whether they offer services in French or not. They bring together 6 simple, effective, and easy to use or easy to implement actions that promote access to French language services for Francophones. They also offer free tools and personalized support from French language service experts. Um, so active offer is a little bit more targeted and in line with the law for French language services, whereas the winning strategies are best practices, guidelines that anyone can use that will help them promote access to French language services. So it's not just for hospitals or just for designated organizations or organizations that fit in a specific sector. All health, social services, community sectors can benefit from using these strategies. So what are the 6 winning strategies? I will do this a bit differently. I won't go through all of the strategies in detail, explaining the best practices for each. These are things that, and we'll go through the different steps for implementation. And it usually starts with a gap analysis. This is really to present an overview of the 6 winning strategies and why they're important and beneficial. Um, and when you start working on your work plan for your organization, you can go through the recommendations for each of the strategies and see if there are things that you're already doing, if there are things that you might have trouble with, and the recommendations that you want to take. So there are the 6 that you see here, and we'll go into detail for all of the 6. So the first one is identify a champion, and there are tools for each of the strategies. The 2 that you'll see here are the first one is the organizational self-assessment form, and the implementation plan. So we also call this like the work plan, and this is what you would start with. But the objective for winning strategy 1 is to choose a person or people in a leadership position who have the ability to influence and motivate their organization at all levels to ensure the implementation of winning strategies. If you are familiar with other quality improvement projects, it is quite common to have champions in an organization that take on the role of a leader that makes sure that not only are we doing the self-assessment to see what we could be doing better, but when it is time to implement, that these people are leading the way to make sure that whatever tasks or deliverables that need to be done are done in a reasonable time frame. The second strategy is to promote organizational awareness of the value of actively offering French language health services. So the objectives for that is to raise awareness among the staff. Um, the second one is to make staff aware of the important role they can play in ensuring a lasting improvement in the active offer of French language health services. And third, promote the safety and quality of person-centered care. So one thing that you can ask yourself is, do you offer training opportunities on the active offer of health services in French to your employees? So in the context of marketing, you would call this brand awareness. So just making people a bit more aware of the importance of French language services and introducing the winning strategies as a potential solution for the gaps that you may have in your organization. This would also be a way to include, with this strategy, you could think about if you have any, if you have an educational plan for your organization in EDI, this is where you could also introduce the importance of French language services and the winning strategies as well as tools. Um, so many ways to do this. There's the free online training in French and in English. You can complete it at your own pace. Professionals and leaders can earn up to 5 professional development credits. And then there are 3 training options. There are 3 modules for the basic training. And of course, the main objective is to raise awareness and offer concrete solutions. The module 4 and 6 are additional modules for managers. And there are additional modules specific to care sectors that are for 45 minutes each. So some of the best practices for professionals and physicians, as I mentioned, I won't go through all of them, but just to give you a few examples. For professionals and physicians, completing modules 1 to 3 and or the complementary modules specific to the care sector of the training program on the active offer of health services in French. There are some more best practices for managers and executives and for board members. Third winning strategy is to identify employees with French language skills. The objectives here are to encourage, there's 3 main ones, encourage the matching of Francophones with members of staff who have French language skills, minimize the need to refer Francophones to another provider, and clearly identify members of staff who are able to communicate in French. We have these little pins that we use nowadays with the winning strategies branding that says "Je parle français" or "J'apprends le français" or "Je comprends le français," and it just takes away that that burden that is usually on the client or patient's shoulders to have to say out loud or on paper that they would prefer their services to be offered in French. When they do, when they see that pin or whatever tool you use to identify your employees, then it makes it easier for them to start a conversation in French. So of course, there's some best practices for the different professionals. And the ones for a few of the ones for professionals and physicians. Um, the first one, for example, would be to evaluate your French language skills by completing a self-assessment of French language skills, and then you send the results of your evaluation to your supervisor. And so in doing that, you would see who should be wearing a pin that says "Je parle français" if they have skills that are up to that level, and who should instead have a pin that says "Je comprends le français," I understand French. So if these are things that you could possibly include in your in the beginning stages of your onboarding for your organization for new for new employees. So it's just something to consider. We've had some great experiences with our pins, whether it be at our events when we're in community, but also at a shopping center or a mall. When people see a pin, they feel encouraged to talk to you in French because you don't always have the opportunity to. So it's been very successful for us. So a few best practices for managers and executives. Uh, First one being ensure that employees assess their French language skills each year by completing a self-assessment form. So this would be, of course, one of the first things that you would have to do to see where they fit and what pins or how they should identify. And of course, there are many tools that are suggested here on the left to help you with that. Some more best practices. And now we head into the fourth winning strategy, which is identify francophones. So promote objectives for this strategy is to promote person-centered care that respects the needs and values of patients and their families. Some more objectives: reduce language discordance, promote safe, efficient, and effective care, and create a sense of inclusion for francophones from the outset. And lastly, facilitate matching with a healthcare professional with French language proficiency. So we talked about identifying Francophone staff, but now we are identifying Francophone clients or people that would come and try to access these services that you may offer. So one question that you can ask yourself is, do you record your client's linguistic identity from the very first contact? Some relevant information that you may want to know. The first step in capturing the Francophone population is to determine which of your clients identify themselves as Francophone. So using the inclusive definition of Francophone is the best way to capture linguistic identity. So something to think about in your intake forms. How do you ask the question if it's asked at all? Some best practices for professionals and physicians. The first one being greet clients in both official languages with their language preferences. When their language preference is unknown, for example, by saying hello, bonjour. This opens up the door, again, like using the PIN or some sort of tool that would identify you to let people know that you are proficient in both languages, and it's up to them to make that decision. Some more best practices for managers and executives, and some more for board members. Now we head into the fifth strategy, which is to match and or refer francophones. So some objectives for this: to promote person-centered care that respects the needs and values of patients and their families. Second one being reduce language discordance, like the last strategy. Promote safe, efficient, and effective care. And lastly, provide French language services to francophones, which is really our big goal. One thing that you can ask yourself is, do you have programs or services where you have enough employees with sufficient French language skills to serve your francophones? Another question: do you know French service providers in your area that offer the same services as you? In case you do need to refer, do you have an idea of on how you could do that and where you would refer if the situation came to be and someone asked for services in French and you weren't able to provide that? So some best practices, and this is considered to be 5A. Um, Best practices for all. Apply best practices for professionals and physicians, and the following winning strategies: raising organizational awareness, identifying employees, and identifying francophones. For unilingual English-speaking healthcare professionals and physicians, the first one is identify your colleagues who have French language skills that can help you serve francophones. And the second one, use key sentences in French to inform your clients of the steps you are taking to match them with a professional who has French language skills. We have some best practices for managers and executives, and some more for board members. And lastly, in 5B, refer Francophones to external providers offering French language skills, some best practices for professionals and physicians, be informed about the referral agreements developed between external partners who offer services of the same quality in French. There are many terms to use to describe these agreements that organizations might have amongst themselves. Sometimes they might have a data sharing agreement where if the person goes and access or attempts to access services in one organization, an organization A, and they fill out an intake form and give their information. Sometimes when there's a data sharing agreement, they won't have to repeat their story when they are referred to another one. So it's important to know of the organizations that are in your area and that offer the same or similar services and care. Some more best practices for managers, and of course, some tools to help with that. And lastly, some best practices for board members. As I was mentioning in the beginning, all of these recommendations and best practices will be in your tools as you start to do the implementation work. But this is just an overview. And the last winning strategy is measure results, which is very, very important for quality improvement. And the objective for that is better understanding the perspective of Francophone clients, adjust organizational practices as required, and help your organization and your Ontario Health team. I represent the Archipel Ontario Health team, but there are many others in the Ottawa region. Plan, measure, and evaluate the provision and access to quality French language services for its Francophone population. So any person that works in data and performance will tell you that evaluation is always the first and most important step. Or planning for it or having an evaluation plan is sometimes where you have to start. So this is definitely included in what we suggest in these strategies. So one question to ask yourself is, do you measure the level of access to French language services and satisfaction with French language services your clients receive? Most, or I'd say a lot of organizations, hospitals, people that offer any type of health care have a post-survey evaluation or a client satisfaction survey that they ask clients to fill out. So this is a question that you can think about if you want to include it to that survey that you may already use. So best practices for health professionals and physicians, encourage Francophones to complete your organization's client satisfaction survey. As you will see with many of the strategies, the goal is not to ask you to start from scratch every time, because getting the buy-in from your board members to add something else to your quality improvement can already be a little tough and difficult. So the goal really with these strategies, starting with the gap analysis that you will do in your work plan, is to see what do you already do in your organization, whether it be for French language services or just for quality improvement. And if there are small tweaks that you can do to make sure that these things are added, it's evaluated, it's recorded, and you can continue to add in these strategies to your work and also evaluate it at the same time. We've had many projects like these, whether it be for, we have one in particular called the Best Practice Spotlight Organization Program that we are part of at the Archipel OHT, and it's a similar process. We always start with a gap analysis. We look at what we're already doing. We look at what we can implement as an OHT, and then we record and remeasure our results. So again, not starting from scratch, because most of the organizations that take on the winning strategies as a project oftentimes are already doing really great work. So the goal is to build on top of that and see what else could be done to offer better services to your Francophone or French-speaking clients. So now how do you plan to implement winning strategies within your organization? This is a question that you will have to ask yourself, but as I was mentioning before, there are a few basic steps to make sure that you're on the right path. The first one is to assess what your organization is already doing. So I call this a gap analysis. A self-assessment form is sort of the same thing. You will assess what you're doing using this form, and the results of this tool will guide you to the next steps. The form is simple and it takes about 10 minutes to complete your guide. So once you're done, you sort of have a roadmap to implementation for your organization specifically. The second one is determine the winning strategies to implement. So we will always recommend to implement the six, but if there are only a few that you want to implement, then that's your choice to do so as well. So looking at your results, you'll decide which ones do you want to focus on, which ones you want to implement, and that's where you'll be on when you get to step number 2. The third is to build your work plan. So once you've decided which of these strategies you want to focus on and implement, you'll build your work plan. How many do you want to implement in the next 6 months, in the next year? Which ones do you think should have the priority? Will you be in charge of doing all of the implementation work? Do you want to have a team that would help you? There's also free coaching sessions from the Winning Strategies team to help you with uh, creating this work plan. And lastly, putting your winning strategies into action. So this is a question we usually ask when the organizations are on the call, but what challenges do you foresee in implementing these winning strategies? Some of the answers that we've received before is resistance from employees and unions, resistance from other managers, lack or inadequacy of or limited financial resources. These are answers that we get pretty often, so it's not new if you're in the same position and thinking this is really good, but I don't know how I'll be pitching this to my board. Please know that you're not the only one. These are answers that we've gotten pretty often. Um, and there you go. We've reached the end of our presentation. But this is just to let you know that we've heard from our partners that there are many challenges in implementing these strategies that you might think are, great and beneficial. But of course, getting the buy-in from your board or directors or managers that's usually the first step. So with our coaching sessions as well, you'll get support from the Winning Strategies team to help you navigate that and also prepare a work plan that is um, clear enough to get the buy-in from whoever from your organization. I've also had that experience at the OHC when I see something that's could be very cool and beneficial and I think worth it for us, but knowing what you are getting into is usually the first step, which is why the self-assessment and the building a clear work plan is usually what will determine the answer. So in all, this is an overview of what you would be getting into as a champion for the winning strategies. We are always willing and able to answer any questions to support you along this process, to support you when you are trying to get a buy-in from your managers or directors, because we've seen those, we've been in those situations many, many times. And yeah, this is just to give you a glimpse of what the winning strategies work could look like for you, your organization, and other champions where you work. Feel free to reach out to us if you have any questions, and we hope that you take on the task of implementing the wonderful and beneficial winning strategies.